Now that we know what miscarriages are and how they work and how they typically present, let's look at the different causes or risk factors that can result in you getting a miscarriage or increase your chances of getting a miscarriage. So basically, that's broken down into three different factors. That's maternal factors, uterine, as well as fetal factors. Most common is fetal factors, and the fetal factors are chromosomal abnormalities. Chromosomal abnormalities happen when basically what happens is that the sperm meets with the egg, and then there has to be, mixture of DNA and, crossing over, mitosis, blah, blah, blah. Because of all those processes that happen where the genes are being mixed together, the mom as well as the dad's genes are being mixed together to make the baby. Sometimes there can be mistakes in the process of that happening. And these mistakes can result in chromosomal abnormalities. These chromosomal abnormalities can either be compatible with life, for example, Down syndrome is a good common example, or you can get chromosomal abnormalities that are incompatible with life. And then when they are incompatible with life, then that's what results in one getting a miscarriage, right? And the unfortunate thing is that I think in private they do genetic testing on the fetal contents. If maybe you end up having an MVA done or an evac done, they do send the contents to be tested for chromosomal testing, just in case or for your interest's sake. But in public, we don't do that. We don't do that unless there's a high index of suspicion or you've had multiple miscarriages, at least more than 3 consecutive. Then only then do we really work out or work up the mother. Then there's maternal factors that can result in you getting a miscarriage. And these maternal factors can be things like, antiphospholipid syndrome, clotting abnormalities or thrombophilia, especially if you're a mom, you've had DVTs or pulmonary embolies before, you have to be worked up for conditions like antiphospholipid syndrome, because these are some of the conditions that can result in one having at least more than 3 consecutive first trimester type miscarriages. If there's also things like hypertension that can result in miscarriages. Diabetes can result in miscarriages. Smoking. If you're smoking mom, you increase your chances of getting a miscarriage. A previous miscarriage or a poor obstetric history can, increase your chances of having a miscarriage. Basically, you stand at a worse off chance of getting a miscarriage. How can I forget age? Age is the most important. That should have been the first thing I mentioned. So age is the most important thing that can result in one getting a miscarriage, especially if you're older than 35 years old. You stand a higher chance of getting a miscarriage. According to the ACOG, if you're a mom and you fall pregnant and you are older than 40 years old, there is a 75% chance that you are going to get a miscarriage. And obviously this is linked to chromosomal abnormalities, linked with moms who have who fall pregnant at an older age, because there's higher frequency of that. Hence why miscarriages at an older age or an age older than 40 years old is extremely common. So there's other thing that's also been linked to one getting miscarriages, like malnutrition. If you're also too thin, like you're on the ends of the spectrum, you're too big in terms of BMI, you're too thin or you're too big, it even decrease your chances of conceiving to begin with. So those are the things that have to be addressed and be looked at prior to conception or you thinking of even falling pregnant in the first place. The other thing that has to be looked at, that's also quite important, it's uterine factors. And the uterine factors to be looked at are things like fibroids. If you have a fibroid uterus, which is very common in Black women, very, 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 very common in Black women. Fibroids are common in Black women, and therefore it is very important to have yourself checked up and go to the gynecologist to do pap smears as well as scans, so that you are checked out if you have fibroids, because a fibroid uterus can result in you getting a miscarriage. So number 2, you can have congenital abnormalities of your uterus. Some people are born with convex uterus, a uterus that's literally like heart shaped. It's or biconvex, and Uterine like abnormalities in shapes of the uterus can result in you getting a miscarriage. And the other thing is, if you have a uterine septum, it can also result in miscarriages. So that's the other thing that, has to be explored. The structural, abnormalities of the uterus can result in increased chances of one getting a miscarriage, and that has to be addressed and looked at. So then in management, the most important thing to prevent infections, because you can get septic miscarriages, a miscarriage that's not managed adequately, and there's products that are left, or parts of the fetus that are left inside the uterus, which then results in infection that can be septic and spread throughout your whole body. That is septic miscarriages, and you don't want that, because one can even end up having their uterus removed. Hence why there's this thing of women having Backstreet abortions, and what results in one having their uterus removed after having a Backstreet abortion is the sepsis that's associated with it, because it's not done in a sterile way. Sometimes they don't have scans to check if everything is cleaned out properly. So then this results in women having parts of the baby inside the womb for a long time, which then results in infection, which then results in them getting sick and having to be rushed to the hospital. With septic miscarriages, it can result in a hysterectomy, unfortunately. And so it's very important that people go to facilities who want to do abortions, go to facilities that allow for that instead of doing it backstreet, because some people have lost their lives and it's fatal. Like, septic miscarriages are fatal. At the end, what happens is that you are discharged on antibiotics, which is important to prevent you from getting infection or infected. I personally, I tell women not to have sex within the first, like for the next 2 weeks at least, or more if they can, because men are dirty, guys. Like, they can introduce infection, especially if you're not going to be using protection. Sometimes I just tell them, okay, maybe for the first 2 weeks abstain, for the next 2 weeks use protection, and then after a month you can try for a baby again, because yeah, guys, like, because the cervix is also open, you don't want to be introducing like dirty stuff down there. No. I don't recommend it, even though yes, according to research and according to the papers, no, there's not much data to support what I'm saying, this whole 1 to 2 weeks abstaining or waiting rule. But I feel it's just to be safe, just to be safe. I always tell people, just wait it out, and then you'll try after, or you'll engage in sexual intercourse, or especially mostly unprotected sexual intercourse, at least after a month, and then anything before then maybe can be protected. With regard to contraceptives after having a miscarriage, you can have hormonal contraceptives as well as intrauterine device inserted immediately. You don't need to wait. You don't need to come back next week, next of next. No, it's literally done immediately. So if you want an IUCD inserted, it's literally slipped in there and then. It's even better because of the whole medium, and it's moist, and it's conducive. You can also get an injection, oral contraceptives, implanon. So yeah, that can be done immediately, and there's no need to wait for that to be done. The other thing about early pregnancy loss is that, especially with regard to one's partner, because um because the pregnancy had not sort of materialized in a way, the baby was not big enough to be felt kicking. So it's basically a mom's experience more than anything. And a lot of moms can feel unsupported by their spouses or their partners regarding, early pregnancy loss, because men can't really relate, because they really hadn't formed a bond yet. To them, it hadn't clicked yet, because the mom was the one who probably experienced, the frequent urination, or the cravings, or the morning sickness. So that with the dad, there was not much connection, unlike when a pregnancy is big enough and the dad can feel the cakes, and the dad is already envisioning the pregnancy and is part and parcel of that. So that can be a dynamic that can be problematic, especially with couples and their whole experience of a miscarriage within a unit. Chances of having two consecutive miscarriages around 2%, according to ACOG, and the chances of getting miscarriages that are three consecutive miscarriages, it's around 1%. So it's quite low. Like getting, most people will have maybe one miscarriage in their whole lifetime. If you know someone who has three miscarriages, and I see this a lot in the rural setting, um, that these women are not being picked up. I saw a young lady, 34, 30, 33, is a grav 9 para zero. Like, can you imagine that? The depth and the extent of what I just said. So this woman fell pregnant 9 times, and then there's no babies to show for it, right? And this happened, she was caught out. So I saw, because we had a regional hospital, she was referred by a district, basically a doctor working at a district hospital, after having been pregnant 8 other times. So the currently last year, 2020, was the 9th time, and no one had picked it up prior to that. Can you imagine? Can you imagine? There's nurses. She was booked, has a clinic book, and I'm sure the previous times they've been just writing it. How is it okay? How is it okay? Let me know. How was it okay for them to write, oh, you're pregnant for the 7th time and you don't have any babies to show for it? Okay, good luck this time around. I mean, women have to be worked up. It's not okay for one to have so many miscarriages and having not seen a gynecologist to work them up for the reason why they might have that type of miscarriage. You don't need to have a medical aid for you to get that type of treatment. You literally just need someone who is going to pick it up and refer you to the appropriate facility. That's all you need. And I guess this is also meant to raise awareness with healthcare workers to pick these patients up. Also, if you have a family member who has so many miscarriages, to tell them to, ask or request to be transferred or sent to a high-risk clinic area which has a gynecologist doctor, or at least a specialist doctor on site. So this then will, assist in them being picked up. So this lady was then sent to us. We assessed her to have cervical incompetence, so her cervix is too short. So that's the other thing that can happen with people, is that if they have a short cervix, then the moment they hit around 16 to 20 weeks, they miscarry. And it happens very, very often. And with these women, we measure cervical length, at least around about 3 months. That's when we measure the length of the cervix. And we also we'll basically just measure the length of the cervix. If it's short, then we will have to book her for a cerclage or stitching of the cervix, so that when the baby becomes heavier, they don't just fall down from the cervix and miscarry, if you know what I mean. So then we book them for a cerclage or insertion of a stitch, and that is done around 14 weeks of gestation. So that's the other common thing that can happen to a lot of women, and this can result in them having multiple miscarriages. And you find that the babies, when they come out and they seem they're morphologically like normal, and microscopically normal babies, it's just that they, when the moment they become too heavy, then they miscarry. That's the other thing that can happen that people have to know about, and I just wanted to raise awareness regarding that. I hope this was something that was beneficial and shed some light to a couple of people. I know I didn't go into depth, like, obviously this is not like a medical type channel. This channel is meant to give you information, realistic information, relatable information regarding your health. And it's meant to give you information that you're able to not only retain for yourself, but able to share with other people and raise awareness regarding issues that may be affecting not only you, but other people or those around you. So yeah, I hope every time I make sure, even if it's like a silly vlog, I always make sure that you pick up something that you didn't know, because the whole point is for us as a nation or as people to be more conscious when it comes to things pertaining to our health, and to make our health a priority, and also to be more aware of things pertaining to our health, because there's so many questions that are unanswered. There's so many questions that were never asked. There's so many questions that were never answered because they were never asked. Maybe there were no inside people. Maybe there were no people around, you or our parents at the time to explain these things to them, hence the lack of knowledge regarding, such issues. So yeah, I hope you learned, something that you didn't know. At least, if you've ever had to go through a miscarriage, I hope this, was not only comforting, but also, enlightened you regarding such issues. Because sometimes you can Google, but sometimes you just need someone to talk to you about something for you to understand it, if you know what I mean. So I hope this also shed a bit of light and comfort to other people, or people who've had and experienced miscarriages, because it's something that is not easy. But I mean, it's everything is a learning experience in this rainbow babies. One miscarriage doesn't mean that you'll never have kids in your whole entire life. It's just meant that that pregnancy had to end in the way it did, and it was just not meant to be at the time. And at the time God chooses, it will happen, no doubt. So yeah, catch you on my next video. Thanks for watching. Make sure you like, comment, subscribe. Yeah, thanks for watching. Bye.